I'm Cassandra Pai, Executive Vice President and Chief Strategic Officer for Lucas Public Affairs, which is based in Sacramento, though we are all working remotely. And I'm looking forward to spending some time with three smart people who are doing a variety of things. So I like their diversity that they represent in a lot of ways for this conversation. My dear friend, Chet Hewitt, who's president of Sierra Health Foundation. Jenny Bach, how are you? Nice to see you. Who's a consultant and former secretary for the California Democratic Party. And then we're joined by Dr. Milin. I'm going to try it again. I tried it 4 times, sir. Ratanasen. I got it. Thank you. I've been practicing. It's nice to see you again, sir. This is really going to be, we're going to do a lot of this. So I want you all to go ahead and unmute because I'm going to pick at you pretty quickly. And I want to turn this into what I hope is going to be a pretty engaging conversation. I was struck, I'm going to turn this over and take a quick look by the mayor's words: challenging, heartbreaking, and satisfying. And I wonder if the three of you gave any thought as you heard him. Did you have 3 words, Chet, from 2020?
I could come up with 3 quickly. It's, for me, clearly challenging. I'm sure it's be on the front of my top of mind for many, many folks. But I would say also disturbing in terms of the way things have actually rolled out, right, and what we've seen in terms of the impacts of COVID and the pandemic and how it's hit certain populations. So beyond the challenge all of us are facing, right, disturbed by the maldistribution of that challenge because some of us have borne a heavier burden than others. I always have to keep something a little bit positive because that's what keeps us balanced and being able to go and do that work. And so I'm going to say, hopeful, and I'll use that as my single word, but it really is about the future.
Okay, I'm going to let that start us. And Jenny, this means that you, and I'm going to call you Dr. R because I'm just not going to screw it up again.
No worries.
But I'm going to give you a chance also to weigh in a couple of minutes. I'm going to mix it up a little bit, because I want to do a couple of things with this conversation. Chet said this when we had our pre-call, something about not wanting to get back to the old normal of disparities. And so what I hope is one outcome from this conversation with the 3 of you is some real specifics around what we mean by back better. And I want to talk about it in a couple of areas, but I want to get a couple of things down on paper that Pat and her team and those of you can maybe spend some time talking about a little bit further. I don't want this to just be some talking. So that's my pledge to all of you. One of the things we said we'd start with is just this notion of tough conversations. And I'm going to start with you, Jenny, and ask if there was a tough moment or a tough conversation in the course of the pandemic that you could call out and think about. And I don't want you to dwell on it as much as I want you to say, would you learn from it that you could use going forward? Does that make sense? So let's start there. Yeah. Give me a sample.
Sure. Well, something very personal that happened to me professionally and personally was I was laid off. I was working for a nonprofit for the past, couple of years, doing outreach and education on the California Earned Income Tax Credit. So a lot of, direct service work and outreach work. And half of our team was let go because of budgeting reasons. And I also recognize that is something that's occurred with a lot of people during this past year. So that's just something that sticks out to me. Personally, I had to see my family kind of go through the same thing. My mom is an immigrant. English is her second language. She was a barber, and during this time, she had to stay home, and we had to talk about finances, and we had to talk about what that could look like. So that's something definitely that occurred with so many families all around the country.
So tie that to what you might do in your current role, or what you think we ought to think about as a community going forward. And that's relative to, I would say, to so much job loss in the region.
Sure. Well, the mayor mentioned earlier about workforce development. I definitely do think that a lot of organizations, at least in my career, working with some CBOs and nonprofits, that there definitely is a bigger ask from the community to have trainings, especially for young people, to build that pipeline and to definitely also be resourceful. And that means, you know, when you hear of job openings or you hear of different things right now, we can be nimble and we're able to give people access to that information in a wider way.
Okay. And so I've heard the term workforce development a lot too. And again, I want to talk specifics. So training is something you called out. Being nimble is something you called out. Who's responsible? Who owns that?
Well, I feel like it's up to so many of us, but if I can call that out, I would say definitely our governmental entities, definitely our representatives, those who have a wider platform and are able to outreach to constituents directly to let them know about openings. Organizations, I know it's tough on them this past year, dealing with so much, you know, providing direct services, but also having this extra job of being resourceful, right? So I think it will come down to many of us, but it's the community effort, especially the work that small businesses in Sacramento and also cities all over California have to do right now, is to collaborate and stick together, and also, you know, let folks know when things are open and available.
Okay. All right. I'm going to come back to that. So that's a little bit around job loss and workforce. Dr. R, let's talk about health. We learned a lot about health disparities in this region, in this state, in this country. If we didn't know before the pandemic, we certainly learned during and after. What did you learn? What was that transformational moment for you? What was that tough conversation in the midst of all of this that you remember, that is helping you lean into the what next, the back better?
Certainly, Cassandra. I remember distinctly February 2020, the conversation around masking. If you recall, at that time, the general recommendation was not for widespread masking use. And I specifically remember being in front of our colleagues and saying, you know, at this moment, we just don't have the evidence to say that widespread masking is necessary at this point. And traditionally, we put the mask on the sick patient, who just could prevent their germs from spreading to you. And on top of that, we were worried about a mask shortage. Now, I distinctly remember, though, that if you follow the scientific method in general, it's always an open book. New chapters are being written all the time. And it just so happens COVID has really put out that process on display in the public in the news cycle every week. So, but I remember saying that approach is to know that things could change. And so we left the book open saying, you know, right now we just don't have the evidence. And, you know, in 1 month, right, all it took was 1 month to know that the countries that did do widespread masking saw lesser rates of infection. We realized that COVID was spreading asymptomatically as well. And so that's allowed, really set the pace for saying, hey, we got to change gears now. And it's okay to change gears when you look at what you've learned so far. You know, you may have stumbled a little bit and you say, we're going to pick up right back up because we've learned something new. And I think that really set the pace, given all the changes that happened for the rest of the pandemic. You know, vaccines will probably get into that as well. But that was kind of the first tough conversation I really remember.
All right, take it forward. How are we better? What does back to better mean, or how do you apply that to this?
I think that
back to better.
Absolutely. I think for us, realizing that you've got to create regular channels of open communication with your coworkers and your staff, and with our patients. And the idea for that is to create a regular ongoing venue where folks can express their concerns, ask the hard questions, and ask them to steer the agenda. So for our patients, we had already focused on our African-American disparities in healthcare. We had already started in 2019. And what we did was a series of telephone town halls called house calls, where we would automatically call the patients and we would ask them questions and do poll questions and have them steer the agenda. So moving forward, my thought is that we've really got to listen to your audience, listen to what they're asking, listen to what they're saying, and have them steer the agenda. And that's how you'll get the engagement and we're there to work for them. And so that's where we know what the next step is and what the next move is. So for vaccines, for example, you ask us the questions. We're not here to tell you the top 10 reasons why you should get vaccinated. We're here for you to ask us, what are your concerns? And then we can move forward from there.
Okay, so regular channels of communication that are direct, listening. But I also like what you said about it's okay to change gears.
Absolutely.
We got to be kind of, okay, I like that. So I'm going to come back to your three in a second, but I want to ask Chet a couple questions. I had you talk to my Catalyst class last year when we were still reeling, if we're honest. And you used a term, failing forward, that was called out actually by several members of the class when we did a summary of what the year was like. I don't remember if that was because it was something that had come about in a tough conversation or not, but I want to tee that up and just say, if it wasn't, give us an example of where you did have a tough conversation or where you learned to fail forward. But I thought that was helpful and probably going to be helpful in this discussion.
Yeah, and this isn't, perhaps so personal, but I think one of the toughest conversations that I was engaged in was one around how some of the initial CARES dollars were going to be used by the county. And, I'm not here to call anybody out. I'm not here to embarrass anybody. That's not the point. But I will say, from a public health standpoint, there was an extraordinary level of underinvestment in the public health campaigns that were needed. And these campaigns are about our economy because reducing transmission rates and getting people healthier are what allows people to come back up. The color-coded tier system is all about transmissions and case rates and things like that,
right?
Which is our way, science-based way of determining, what the spread of COVID-19 has actually been. And I'll say it was a really challenging conversation because there was a huge, what I would describe as misappropriation of, CARES Act money to a sector that was not going to be helpful as a response to COVID. It should have been invested in that public health infrastructure because the initial response to COVID was not a medical intervention unless you were really ill or sick and need to be hospitalized. It was a behavioral intervention. Wearing a mask in public is a behavioral change. It's not a clinical intervention in the way that we typically think about taking a pill or something. So, that to me was challenging. The failing forward was after that failure, we were able to have tough conversations with leadership around the county and make a change happen where public health was able to receive the resources it needed to begin to help us address COVID in a much more effective way. And one of the champions of this was on the screen earlier, Dr. Cassandra, who, talk about a tough conversation. And on a stage where it was hard to say what really needs to be said, and seeing someone stand up and actually do that is what really gives me hope about the future as well, because we failed in terms of how we were going to appropriate close to $100 million of resources that came to this county to deal with COVID-19, the pandemic, and not just around medical interventions, as I said, but also around small business and other things that it ultimately was used for. And we had to have a really tough conversation and a level of advocacy to get folks to understand that that was not a smart way, not just opinion, a smart way, a thoughtful way to go about dealing with a health crisis. In Sacramento, nor would have been as smart any place else we had to deal with this, but we're really talking about our particular region. The upside was champions showed up.
Yeah.
Gears were changed. I'll borrow your term, Dr. R.
Okay.
And folks were able to get back on a path that I think was much more helpful, much more defensible, because of the voices that were actually heard through a series of meetings, some of which were public.
Can we keep that up? Can we be, to use Jenny's term, that nimble still, or are we going to sink back into our old ways when the crisis is over, Chet?
My sense.
Go ahead.
My sense is if this notion of better is going to be something that's going to be durable and not du jour, not the term of the day, then this nimbleness and flexibility is going to be one of the characteristics. Because otherwise, building back better is kind of a pithy phrase without a lot of definition to it. And I think one of the tough conversations we need to have is putting some clear definition, some measurables into what better is going to mean for our kids in school, for mental health, for those who have suffered, for the 200,000 kids in this country who have lost their primary caretaker, for the uptake in violence and other things which are not just about the center city investments, but are about the people who have suffered the most disproportionately because of what we just been through and what we're still going through.
So Jenny, I see you nodding. Give us a little bit of a response to Chet's comment, and or maybe the same answer to my question. Can we keep up that nimbleness now, or will we fall back into our old ways?
Well, I agree with Chet. I think we have to. There has to be that kind of flexibility. And I do agree there has to be measurables. And what does that exactly mean? It goes to your question a little bit earlier, Cassandra, about, who's responsible for that. And I think that we actually have to all be at the table and discuss that. Yeah.
Chet, what does better mean? If you say we need to measure what better means, what does better mean to you?
For me, at a conceptual level, it really does mean, measurable improvements across a number of areas that this community has got to engage in conversations to clearly identify, right? And those measurements have got to understand the baseline, that is, where are we starting?
Okay.
Right?
Yeah.
And what our North Star or goals are going to be,
okay,
and what are going to be some of the interim steps to show that we're getting there or moving in that direction. So it's not like from start to completion, but that we're going to hold ourselves accountable, right? For seeing progress along, defined measures, to see any number of things that we believe are important to improve. And the reason why I'm not defining what they are, I think that's part of a community conversation.
Okay.
I have my own preferences about what I would like us to measure as being better, but it isn't back to normal, because I think if COVID showed us anything, was how fragile our society was under its normal past set of circumstances.
That's right. And I'm going to ask folks in the audience to use the chat. I'm going to try to ignore it until they all start to come in. Just use a word or two to define in the chat what you think of as better. Chet, we've got vulnerable populations, including homeless people, seniors, but kids is just you want to fix everything, but when it comes to where do you start first, don't you have to start with kids in terms of doing better and starting that measuring and starting that baseline and going to that North Star? They have no control over any of this.
I like to think that, it's easier to get at our community. I know my panelists my co-panelists will probably agree that, it's probably easier to get, consensus around some of the things that would really directly affect kids and families, because they do come as kind of a package deal. But some of the concerns that I personally have about what kids are confronting is deep and real. You have kids who are going into 10th grade who have been in a high school campus before, or kids going to 2nd grade who've never been to school before. I talked about the 200,000 kids who have lost their primary caretaker in this country. There's been a level of trauma and harm that young people have experienced, and older folks as well, that needs to be dealt with. But I would like to believe that, that we're going to prioritize, not exclude or ignore other people or populations. It's not what I'm saying. But we're going to prioritize getting our kids as healthy as possible, because there isn't no great economic future, a social future, if our young people are not healthy and well.
Dr. R, give us a little bit of a reaction to what you just heard. And again, let's talk a little bit about, we'll use Chet's term, kids and families. What does better look like?
You know, our kids have arguably suffered the most through the pandemic. And so as they start to try to get back to better, I think part of that was being able to go back to school in person in a safe manner. I think part of that is us protecting kids right now is by trying to vaccinate as many eligible folks as possible. The more folks who are eligible that get vaccinated, we protect the ones that aren't vaccinated as well. I think for us, it's been trying to eliminate as many barriers as possible also to access to care. And so whether that was through video visits or trying to increase telephone visits or making safe places to be able to do in-person visits in the healthcare field, I think that has also been just as important in getting back to better. I think for getting back to better, you know, it's important, you know, I'm going to go back to listening too, right? We've got to listen to our kids too. And what's most important to them? What are they looking for? How can we help them? What are they feeling right now? As it may not be exactly the same priorities that we have. And so we've got to find a way to meet that as well.
Right. While I'm at it, tell me your 3 words.
I would say, you know, the word that comes to me immediately is humbling. I think this pandemic has been so humbling, and I think if it hasn't been, you've missed something, because I'll tell you, right? For me, I say this all the time, just from the individual level of trying to diagnose COVID. I tell patients, I tell my colleagues, I tell my coworkers, staff, if they're sick that day, you've got to go get a test. You can't guess. Have I been wrong when I thought somebody had COVID? Yes. Have I been wrong when I thought they did it? Yes. It's just so unpredictable there. So you got to get a test. So I'm sorry, that's on the individual level. On the macro level, even these surges and trying to predict what's happening in the future, you know, and I've told folks before already, this most recent surge in Sacramento, humbling for me is I personally did not think the surge would be as bad as it was going to be. I thought that we had a decent vaccination rate and a decent amount of prior infection, which is not a good way to get through a pandemic. You don't want everyone to get affected, but unfortunately we had some of that, but it wasn't enough. You saw our hospitals hit the hardest in California. And so humbling, I'm sorry, that's one word. The second word would be transparency, I think is a big one. It goes back to my venues of communication. The more transparency you set up in the beginning, I think the easier it is to change course and relay messages. And the third one I'm going to say is recognition for others, recognition for all of the people who've been working hard. It doesn't have to be a big award. It doesn't have to be a party. When you thank people, it makes you feel good. It makes that person feel good. For all of the ways people have been stretched and are stepping up. I think that compliment, that recognition you give to somebody else will make such a big difference in their day.
Thank you. And humbling is an understatement. That's all I'm going to say about that. Jenny, why are you nodding?
I completely agree. It was most definitely a humbling experience, and I wish that were one of my 3 words.
Well, one story I'll share with all of you is the week after George Floyd was murdered, we were meeting as a staff by Zoom, of course, and I'll say, touched on the murder and made it plain that if folks needed some time or wanted to connect with any of the leadership on our team, that they were welcome to do it. But if I'm honest with you, I was processing it myself. And I tend to go into my own head and into my own space and into my own worries and my own concerns. And I just kind of went into my bubble for a little bit and got called out by one of the members of my team, who said by about Wednesday or Thursday, we need to hear more from you. And I was not prepared to share and open myself up like that when I was dealing with my own pain. That was a very humbling experience, Dr. R. And it's still, it is literally one of the moments of the pandemic I don't think I'll ever lose, because I knew it, but I know now that those are moments when leaders really have to lean in. That's our responsibility. And so I guess my better is, I hope it doesn't happen again. I hope we don't have to deal with that kind of pain again. But I know that when I'm feeling it, I've got to be more cognizant of the fact that people around me are feeling it as well. And they're looking to us. They're looking to all of us as leaders to do more, and I'll use the word, to do better. So let me go back to something. Well, I want to do this. I want to go through the chat for a couple of minutes. Some folks have said humbling is a great word. Someone is defining better as channels are defined clearly and integration is seamless. I see acknowledgement and recognition goes such a long way to lift someone up. That's for you. Nicely said, Dr. R. Back to better, to me, Rodney Green says, means equality and opportunities, equality in the justice system, and a better education. So I'm going to put the spotlight back on Chet, because one of the things you also raised in our early conversation was this whole notion of, for lack of a better word, just kind of integration, with back to better and doing things differently means recognizing that health and work and, to the point that was made earlier by Jenny, having a job and having finances be steady. So all those things are intertwined in better. It feels big, Chet. How do we do it? How do we talk about it? And then how do we move it forward?
I think one of the challenges, one of the challenging conversations we have to have as a community is to try to agree upon some of the things that if we do address them, since you can't do everything all at once, that they're likely to have spin-off effects and impact some of the other things that we're concerned about as well. But let me give you an example. We've got to deal with housing because dense housing was one of the primary vectors for transmission of COVID-19. And we've seen that in populations, particularly our Latinx communities, where people who lived in dense housing environments, often intergenerational housing environments, actually had higher rates of transmission than communities where people were wealthy and tended to live more isolated lives in their homes that had less people living in them. And we know that's a function of affordability in our community as well. So, dealing with the housing crisis that we are experiencing, clearly to get people off the streets as a high priority, but also to allow people not to have to live in such, dense environments where you sometimes have multiple families living in the same space would be incredibly helpful to the health. Now, it would have been helpful for perhaps slowing transmission rates, but we also know there are other effects associated with that around living a higher, better quality life for folks as well. It's better for kids in education who have places to study, quiet spaces at home where you can do your homework. So when I talk about some of these things being integrated, I'm saying we gotta fix some things that have series of impacts beyond what the issue itself might be. So housing, around affordability, around improving quality of life, and upon building or improving the educational opportunities that kids actually have when they're not on a school site, but when they're home and need places to follow up on what they may have learned during their day at school. Now that's one, and I said I'm reluctant to choose because I think that those come from community conversations. When I think about the integrated nature of it, at Sierra Health, we are a social determinants of health foundation. We love our clinical care partners like Dr. R. Use them to help us educate folks about why getting vaccinated is really important and the science behind that. But we also know the social determinants of health drive 85% of a person's health and well-being. And those things are about work quality and job quality and housing experience, the ability to pay your bills, access to care when you need it, healthy food and safe streets as well. Those things also are part of what we need to address. Because if we're going to build back better, we got to build the interventions that allow those issues to be dealt with, along with the issues, the clinically associated issues around disease as well.
Okay. Let me get your response, Dr. R. I think that's spot on.
Yeah, so well said, Chet. And I think it's so important. It's back to humbling, so humbling to realize, and myself as a doctor in the last few years in my bubble, realizing, oh, you mean the medicine that I prescribe isn't just going to suddenly fix that person's life, right? No, of course not, right? And so there's so much more that goes into health and livelihood. And so I think from the health care perspective, I think that focus on equity has been so important for us. And I know, empowering folks for whatever steps that they can do. And I know for us, Kaiser Permanente has made a lot of investments into the community and community-based organizations. So we hope to partner that way. I will say to Chet's point also about, me coming in as the doctor and teaching folks about vaccination. I'll tell you, I think, again, humbling, that's pretty much reached, I think, its limit. It's, who knows the community, right? And so I'm happy to be there to partner, but I'm not, I think us as healthcare providers, we're not there to stand in front and say, we know what's best for you, right? It's more about, we can help you, let us know how we can help. And when it comes to vaccinations, let's talk about your personal stories, and before I delve into why I think the science is there. So I think it's us really, again, it goes back to, I said, listening to our audience. In our local vaccine center over there in South Sacramento, we started polling folks who've come in. It's who what got you to come in, right? And how many people said their doctor? It's about 5%. What was the majority of it? The majority of it was their friends and family. That's right. And and so the people, the trusted messengers in their community. So we've really got to focus on uplifting them and giving them their platform. So I'm the one that's supporting them. You let me know what you need, and I'll be there to help.
I want to go to this piece around trusted messengers. We've got about 85 or 86 business leaders on the phone with us today. If it's housing and affordability and quality of life and work quality and access to care and healthy food, all those things that Chet teed up, where's the business community responsibility? What's the business play? What do you think, Jenny, business leaders ought to be doing relative to moving us back to better? I know you're going to say be a part of these conversations that all three of you have said have to be community-based, but I'm a business girl. I come out of the business community. Shouldn't we be doing something else? Shouldn't we be doing something different?
Well, sure, thank you. I definitely think that it depends on the business and the structure, but a lot of the work that we did when it came to trusted messengers and getting outreach and education resources out was work with, faith-based organizations or groups, churches, having them have a newsletter on the wall. We worked with grocery stores to put even, a small banner with a website or QR code that they do now on corners of the grocery store at the entrance, especially ethnic grocery stores. We see a lot of them here, especially in the South Sacramento region. In the Northgate region, we see a lot of our ethnic grocery stores. So I think, there's even shops, shopping centers and small retail shops can have, just like a bulletin board of some sort at the entrance or inside. I think that's super helpful. I certainly see them. It's even better if it's in language. That's just so important right now because we have a lot of elders who don't go online or who don't use the internet. We have folks who might not have at-home internet. So it's so important to make something either mobile friendly or have something already in language that's easy to direct people to what those resources could be.
Appreciate that. Thank you. Chet, business community, from your perspective, leaned in enough, moving towards better, or I'll say it this way, what can the business community do better?
I think leaning in more and need to do better. I said I'm an optimist about what the future portends, but clearly there's more to be done. Business leaders as champions for addressing some of the social challenges that we actually have more than just articulating them. You know, yes, we're all upset about homelessness and what it means in certain corridors and business corridors. Yeah, but you know, are we going to get out there and help promote some of the ideas that are going to lead to more affordable housing or safe grounds where people until we can house them can live with a level of dignity? I think some of those social issues are important. I think speaking out about, you know, what needs to happen around changes in education. As the future workforce, direct relationship with the ability to grow our regional economy and so forth. And, you know, really thinking beyond, and I know the mayor and others spoke to this, around the central city as well. To really talk about how do you create destination sites so you can help spur economic activity in some of our older commercial corridors, where you have more ethnic businesses and businesses of color. That if we're going to really think about building back better, then we have to build back more equitably. And that's going to start with the investments being more equitable than they have been in the past as well.
Let me ask all three of you this question. I don't want to ask what was normal. I don't mean that. Well, I guess we know what we think normal was. What do we want to hold on to that, you know, from before March 2020? What do we want to hold on to? What was working that we include in the better agenda? I'll start with you, Dr. R.
It's a little specific, but I think for us in healthcare, when we weren't doing office visits, was the emergence of telehealth and doing these video visits, trying to become comfortable in that space, making sure a space that is easy to access and an alternative form of care that, you know, for folks who might be difficult to come in. I think that was something that we learned to adapt. To Jenny's point, though, not everybody has access to video, and that was a big issue. And so I think that's that balance there. Is we found this new venue that's a great model of care, but we cannot rely on only as that model of care right now. We can't leave the folks behind. And that was also an issue when COVID vaccines first came out. A lot of criticism across the country was, you know, we are vaccinating the elderly first, but it's hard for them to access an appointment. And how many of them know how to get on the computer to book an appointment? And so I'm so glad as across the country institutions now, we have made that, we've tried to break down all of those barriers, right? No appointments, just show up. You know, at our vaccine center, we're not asking about membership status or immigration status, or we have interpreters. And so trying to break down those barriers, of course, leverage technology, but also don't forget that a lot of people don't know how to use that technology also. So keep them in mind.
Good. Okay. What do you want to keep or hold on to, Jenny, that was working?
Well, I agree. I don't know if this is a good or bad thing, but a lot more groups that I worked with were accessible via Zoom. So it was almost like back to back all the time in this past year. But I also do think that kept more of an open line of communication that I don't feel that I had, you know, before. It was weekly, or it was almost daily, or every other day, working with different organizations providing these services. So it definitely was beneficial to be able to reach folks, and people were ready to help. But, you know, I also think something, you know, just maybe more of a feeling that we should think about is being empathetic. You know, as you all have mentioned earlier, we don't really know what others are going through. We don't know how others are processing. We don't know how others are dealing with their mental health during this time. And, you know, for my community personally, within the Asian and Pacific Islander community, we also faced a lot of racial discrimination, xenophobia, and hate. So I definitely think that, you know, we all need to have a little bit more empathy towards each other and be ready to help.
Okay, I hear you on empathy, but am I hearing you say you really want to keep going with those Zoom calls back to back just to keep the lines of communication open? All right, Chet, what would we keep? What was working?
Well, that's a hard one for me. And maybe because, you know, given what I do, you know, so much of it is to try to pick up pieces of things and try to find things.
Yeah.
You know, I don't know if this is a direct answer question, but let me just say, one of the things that's really present for me is that we really are all in this together. You know, and I know we say that because we're always proud of, you know, Sacramento, and I, as I am and still am, and, you know, we're proud of our diversity, but I think take that up a notch and say we're all in this together. And the second part of this for me is, let's recognize the folks who have always been heroes, and we know that they're heroes now. All the farm workers who picked food, all the folks who worked in meat packing plants, we had high transmission rates, all the doctors and nurses who showed up when those ERs were packed, EDs were packed with people who weren't feeling well. It wasn't always those who are well-heeled and doing well, you know, economically, that have guided us through this predicament. A lot of the folks who have always been heroes, we can define them as newly recognized heroes. We need to, as we're thinking about building back better, we need to make sure that their lives are better too. Otherwise, it's back to normal.
That's right. Okay, that's good. So I'm going to tell the audience that in about 6 minutes, I'm going to turn this over and start to get some questions from you. So I've probably got one more question for this group. And let me just stop and just ask Jenny and Dr. R, Chet, you have anything you want to say or ask of each other? Because I've still got a couple more questions to go. Jenny, you want to ask Chet anything about his work?
Any questions specifically, but I do really appreciate both of you, Chet and Dr. R, and all of your work. I know that it's been super hard with the pandemic and so many moving pieces. I definitely relate to a lot about what you said about our kids who are struggling the most right now. I do work with a school board member, and it is hard, you know, just communicating with parents, especially ones who are still afraid to have their kids back in school and being able to explain it in the right way. So I'd love to have a discussion with you after this panel to learn more about that. Thank you.
Yeah. And I'd just like to thank Dr. R, who I think made a really important point about his role in talking about how to protect yourself and family during the pandemic. And just say that from those experiences and trainings, we now have a vaccine ambassadors program where we're taking all that knowledge that he shared and giving it to folks in communities, authentic messengers, and allowing them to carry forward not just the aspirations of doing a good thing, but really having the knowledge to explain why it's a good thing. So that knowledge transference as a way of, you know, making equity manifest, right? A whole new layer of experts who can explain why getting vaccinated makes sense. So thank you.
Nice. How about you, Dr. R? Questions or comments for your fellow panelists before I pick on you a little bit more?
I just want to thank Chad and Jenny for sharing their knowledge and wisdom. For me, being in my healthcare bubble, I want to thank you, Cassandra, for having me on this panel. Also, it's just been very enlightening to me. I love hearing about the intersectionality with all the other stuff that exists outside the healthcare world. So I'm going to go back to humbling for me to hear these other stories, and makes me really think about what else we can do and how else we can partner. And so I've got questions, but they're really into the weeds. So they're not, we could save them for later.
Like a true doctor would, right? Well, I'm gonna go there. I'm gonna throw a tough question, I think, to all of you, and that goes to our politics and our civic leadership. And Jenny is a consultant. Dr. R is in the healthcare field. Chet runs a large foundation that does a lot of good. He's in a position to change a lot of lives through his leadership and through the resources that that he's got at hand. But, you know, Jenny, you called something out early on when you talked about workforce development and training. And I asked you, who owns some responsibility here for getting us to better? And you called out government. You also called out community-based organizations. Later on, you talked about faith-based, friends and family. I'm with you. But I want to talk about civic leadership and government and just ask, do we believe again that that's better? And if we don't, or if we think we can offer some ways the government might improve, how it helps us get to better, what might that look like? And I am going to pick on you first, Jenny, because you called out government first.
Sure. Well, I definitely think that a lot of local governments provide financial resources for community-based organizations to carry out a lot of the work that they do, which includes trainings. So I don't think it solely rests on government. Like I said, it takes many of us, and we can't put a strain on any one sector to have this kind of responsibility. But I do think that financial resources that goes to nonprofits and CBOs mean a lot. It's a big deal. I know businesses also do contributions or donations, and that also goes toward a lot of great work, like workforce development, that's so necessary right now.
Thank you. All right. Dr. R, even from your bubble, what do you think about what government does well, can do to get us to better?
I think, government, whether it's from the federal level, CDC, FDA, to the local level, public health, I think they have that bird's eye view. They have the centralization connecting spot, allowing to connect us to the folks we need to connect. And so for us, public-private partnerships are important, listening to our community, listening to our business partners, seeing where we fit in there, and, taking the cue from if government is the facilitator of that, I think that they can help us connect all those groups.
And Chet?
I think the challenge for government going forward with all the new investments from CARES and ARPA and infrastructure is not just to build bigger government. And I'm a little what I'm saying. They've got to invest in local intermediaries like the Asian Chamber and other chambers, like community colleges, which do a lot of employment and training work as well, particularly in their certificate programs, as opposed to their degree programs. Groups like the Urban League that does employment and training services. We've got to make sure that some of those dollars get to those intermediaries, because at a level that's not ultimately personal, in the way that we think about authentic messages, those are authentic community organizations that people will come to for help and assistance when they need it. Not because we're coming out of a challenge, but because they've always been there and they have those pre-existing relationships. So let's just not just build bigger government. Let's build more efficient government by deepening the partnerships with communities.
I like that. Okay. So we're at 4:20. I'm going to want to look for some questions. I like to do this when I have these kinds of conversations, because I think a lot of what's been said has been so helpful. We started out with Jenny talking about job loss and what better looks like as a result. And that goes to workforce development and training and getting the word out. And I like that term you use, nimble. And you gave some responsibility to government and to CBOs. But as Chet just said, CBOs are so important at this stage. And as we think about what better looks like, because as Chet says, they've got the authentic relationships. Dr. R, I think if I don't remember anything else you said today, it was that it's okay to change gears. And what that says to me is we're going to be flexible. We're not going to go back to doing things the old way because that's the way we always did it. The reason we have made the progress we've made relative to this pandemic is because, as you described, we did have to change gears. Medical community kind of switched it up on us here and there. And I was like, okay, that they got on a white coat. They said, okay, I'm doing it. That's fine, even if it changes. So I like that you said that. I like that you talked about regular channels of direct communications. And you also talked a lot and used that word listen, which several people called out in the chat. Chet, spot on about a lot of money potentially not getting to the right places relative to public health campaigns at the beginning of the pandemic. You said gears were changed. I thought that was great. But you also talked about, better meaning some measurable outcomes around kids, around families. You said, let's start with a baseline, set out that North Star, and then make sure we bring the community in to the conversation. And several of you said it'd be important for us to be sure that business leaders lean in. So a couple of you said something very simple. Just say thank you. Just say thank you to the people who are in the front lines. I love the word empathy, Jenny, that you use, keeping lines of communication open. Dr. R said telehealth is something that ought to be on the list for better, leveraging technology, but remembering everybody doesn't have access. And then Chet, I think I'm paraphrasing, but I think I got it right. You talked about housing as being one of those foundational things we've got to do better, because there's so many other things that are going to get better as a result. And work quality housing, access to care, healthy food, but just having a place that you feel safe and that a kid feels safe to do homework goes a long way. And I also heard you say all of that impacts the economy. The last thing I'll talk about, as you all said, is, business leaders need to be champions, but we also, and I'm a communicator by profession, so this notion of using friends and families, using organizations on the ground, using faith-based organizations as trusted messengers and getting messages out in language where we can, all really important. So thank you for a really great and meaningful conversation that I didn't know how it was going to turn out. So Janice says that I've got one question, but Janice, I don't see it. So I see it now. Okay, so I'm going to go to this question. This is from Evan Lee. The past 18 months, we really saw the Sacramento community come together and show many examples of the organizational theory of mutual aid. What are your opinions on the potential that this voluntary exchange of support and resources has as we go beyond back to normal? So I'm going to just ask who wants to take that one. Anybody? You want to take it, Chet? You're nodding.
Yeah, I totally agree, because, we launched a Sacramento fund, and, we raised millions of dollars over a several-month period. We helped the food bank restock and saw the food bank open up new distribution sites that were manned with volunteers who showed up on Saturday mornings, put boxes of foods in trucks. I mean, it was beautiful. I mean, I can get emotional. It was simply beautiful. So I totally agree with the person asking the question, a lot of mutual aid. I hope that we see some of that transition as we go from response to recovery. Because the mutual aid came in response to the pandemic. Now, as we can begin to think about, we still got a lot to do to get through COVID. I don't want to create a kind of a false situation that we're done. But as we move into the recovery phase, I hope people continue to show up for both the political conversations about what difference needs to happen, to continue to show up to be in support of young people who still need a lot of adults in their lives, caring adults, to do some of the things and show the kind of support that they're going to need as well. So I'm hopeful that it's able to transition from the immediate response work to the conversations that will lead to more durable interventions, so that that baseline that we could chart from where we started will be very different in 2 or 3 months or years from now, when we come back and we will ask ourselves, not, are we going to build back better? Did we build back better?
That's right. Jenny, your response? I see you nodding.
Well, I completely agree. I do hope that mutual aid is something that remains after the pandemic. A lot of people reached out. A lot of people volunteered their time whenever they were open and free. I do think before the pandemic, some mutual aid did exist, but I think I saw like a great influx of that afterward. And it shows that we care. It shows community, and it shows that we support each other. So I definitely think that, it's something, I hope that we can encourage our young people too, to continue getting involved with that.
Yeah, good. Dr. R, your perspective?
I think I hope I'm using the word mutual aid right. It's not a term I hear in my industry, but if it means helping each other out through beyond traditional barriers for us, pandemic has really kicked that into gear for us. And whether it's grants or was it the boots on the ground, talking pop-up vaccine clinics, guesting on with different groups like Sacramento Collab or Black Child Legacy and Asian Resources Center. It's been really beneficial to us too, in the sense of the joy and meaning we get. I can tell you so many doctors who, even if they're overworked, after they give one of these sessions or get to talk to people in the community on their own time, they feel so good about it. They can't wait to do it again because it's such meaningful work to see it make a difference. And so absolutely, I envision that to continue further. And it, again, really gives us joy and meaning in what we do.
Can we keep the sense of urgency? Because some of the way we responded had to do with the fact that it had to get done, or people were going to die, or people were going to starve, or people were going to freeze to death. How do we hold on to that sense of urgency as we look to better? Any ideas?
I'll start. I think that sense of urgency, I think it's going to be here for a while. Now, that probably is not the question you're asking, because I think that's still, we're going to be benefiting still from COVID recovery, that sense of urgency. But I think the response that we build from it, the practices we build, such as being flexible, such as leveraging technology, or the continued partnerships that we grow here, the relationships that we build here, I think we'll be able to continue that sense of urgency. Now, that sense of urgency might move on to a different topic. You know, I think we all want to put COVID behind us, so the sense of emergency can be now fully focused on the inequities we have.
I appreciate that. Thank you. What do you think, Jenny? Can we hold on to it?
I think in many aspects, yes. Right now, I feel that we're still in the thick of it. In COVID and in healthcare, we still have a lot of folks who are unvaccinated or need access to that. So I do think that for a long while, we'll still be in that. In the long run, you know, as Dr. R said, it might transition to something else, and that's okay. And I think that, you know, as we approach new issues and things are happening within our state economically, we have to be flexible toward that and react. But hopefully, as Chet mentioned earlier, be more proactive.
Okay, thank you. Can we hold on to it, Chet?
Yeah, I think we will. I think some of the vestiges of the pandemic, even when our masks go away, are going to still be with us. I think we've all been, you know, we will all have a level of PTSD around what we've experienced. The level of loss, the 70,000 Californians who have lost their lives, the 750,000 people in America who have lost their lives, the 4.6 million cases of COVID in California, and 46 million in America. I think the emotional toll that this has had on us will be around. And I hope that we don't just stay focused in order to deal with this downside. I think our big challenge is, can we stay focused with a sense of hope for a better, more equitable, more just future? I think that will be our challenge. Not just to fix the immediate thing that's broken, right? But to fix all the things that reveal how broken our society really was.
Right. So let me close by asking everyone now to, because I'm an optimist like Chet, can't help myself. And I know for me, it's faith and family and friends that just do so much to foster that hope. But I've also, as you all said, saw so many random acts of kindness and goodness. I mean, big chunks of money being spent to do a lot of things, but then small things that I saw people do just out of the blue, randomly, because it was the right thing to do. I just saw so much of that. And so I hope we keep that as well. I can think of an example of a friend who just sent a note to a group of us on Twitter, just DM'd us and said, I have found a home for a woman I met who is homeless. She is going into get into the system tonight. She is in her apartment. If you have anything, blankets, towels, toilet paper, bring it. And 10 people showed up, and the place is furnished, and she's got pots and pans. and one person making a difference for one person. So that piece I want to also not lose sight of. What gives you hope, Jenny? What's the thing that gives you hope going forward?
I work with a lot of youth, and I definitely want to say them, whether, they went through a tremendously hard time, not just with school and mental health issues, but I think just seeing really heavy news every single day, and on social media, right? So I definitely think, and I have just so much hope, seeing our kids and seeing how involved they're getting, whether it be politically, civically, or really educating themselves on the issues. And especially as me myself being a child of immigrants, where I translate a lot of resources and work, I've been seeing a lot of that within our children and our young people, and they're happy to do so.
That's great.
Mm-hmm.
Chet, what gives you hope?
All those heroes, many of them who, I talked about the food banks, many of the folks putting the food in those cars were young people who just randomly showed up to do a good deed. So, it starts with people. I think it ends with people who care.
Awesome. What gives you hope?
I think seeing how many folks in leadership have this new mindset that is really shaping things down in the future, that mindset being one of humility and flexibility. And to me, there's kind of an old school mantra of authority always being right, and that's the end of story, and you don't question, and it's all about winning, right? And I just see that mindset change from business to healthcare to parenting to schools. About now it's collaboration, that mistakes can be made, but we're going to learn from them, that it's okay to always continue to be flexible moving forward, that when it comes to recognizing and humility, those are all things that we now value as qualities that we want to see in leadership. And so that really does give me hope. I mean, just talking to all you folks today and seeing how much is out there beyond my healthcare walls, again, that gives me hope.
Well, as a reminder, you all said you want to keep telehealth, you want to leverage technology, but remember, everybody doesn't have access. You want to keep the lines of communication open. We want to continue to be empathetic. We want to remember, as Chet said, that we're all in this together, and we want to celebrate the heroes. So with that, let me thank the three of you for a wonderful discussion this afternoon. Dr. Ratanasen, got it. Chet, Hewitt, and thank you all three for being with us. And I will now turn it over to our host and just ask that everybody stay safe, stay healthy, wear your masks. And if you don't have a vaccine, by all means, please get one. Thanks a bunch.
Thank you, Cassandra. Thanks, everyone.
Thank you.
Thank you to our panel and our incredible moderator, Cassandra Pai. From Chet Hewitt, I heard about the value of community partnerships and the need to invest in them. From Jenny Bach, I learned about the importance of empathy and acknowledging that we don't know what others are going through. And from Dr. R, and I'm not going to try to pronounce it, we walk away with the notion that new chapters are being written all the time. And we have opportunities to learn and to change, and that change is okay.